Hello everyone. So today we will be studying another topic of pharmacology, that is therapeutic drug monitoring. So as regards therapeutic drug monitoring, first let us come what is therapeutic drug monitoring. So therapeutic drug monitoring deals with the drug and its metabolite concentration in the blood. So why at all therapeutic drug monitoring is required? It is required in two circumstances. What are these circumstances? So first one is to optimize a therapeutic response, that is for example in seizures or in depression etc., or to avoid drug related toxicity. So in these two circumstances we do the therapeutic drug monitoring. So the final aim of therapeutic drug monitoring is to individualize the dosage regimen by maintaining a drug concentration within a target range. And what is this target range known as? It is known as therapeutic range or therapeutic window. Okay, so within this range we have to maintain the drug concentration. So coming to the concept of therapeutic drug monitoring, so there are three case scenarios in this. First one is that some drugs, they have a close relationship between the plasma level and the clinical effect. So if in such cases where there is a relationship between the therapeutic plasma level and the clinical effect, in those cases only therapeutic drug monitoring is required. Whereas if such relationship does not exist, then therapeutic drug monitoring is of no value. Second case is that in the cases where the therapeutic outcome is objectively measurable and easily quantified, for example like prothrombin time, INR in case of antithrombotic therapy, or blood sugar in case of antidiabetic therapy. In these two cases, the measuring the plasma levels of the drug has little or no added value. And when precise therapeutic endpoint is difficult to define, or the drug having narrow therapeutic index, in such cases the monitoring of the blood levels of the drug becomes essential. So in those cases the therapeutic drug monitoring is required. Now coming to important formulae with regards to the dose. We all know that the loading dose is given by the formulae AVD, that is apparent volume of distribution, or so to say volume of distribution, into concentration divided by F, where F is the bioavailability. And maintenance dose is given by clearance into steady state plasma concentration into time divided by bioavailability, that is F. So therapeutic drug monitoring is useful in which cases? Therapeutic drug monitoring is useful in case of drugs having narrow therapeutic range, or when the drug has got a relationship, there is a direct relationship between the drug metabolite levels and the pharmacological effects, and the therapeutic effect is readily assessed by quantitative measures or clinical observation, or when at single dose there is large inter-individual variability exists. And also appropriate analytical techniques should be available to determine the drug and the metabolite levels. In such cases therapeutic drug monitoring is useful. And in which cases therapeutic drug monitoring is unnecessary? In cases of hit and run drugs like MAO inhibitors, PPIs, or aspirin. In these cases, like hit and run drugs, the therapeutic drug monitoring is unnecessary. And in which case, in the cases where pharmacological effects, they are easily quantified, like the blood sugar level in case of a diabetes person when he is taking anti-diabetic drugs, or the concentration effect relationship remains undetermined, or the drugs having wide therapeutic range. So in these four conditions, the therapeutic drug monitoring becomes unnecessary. Now we come to the components of therapeutic drug monitoring. So therapeutic drug monitoring has got mainly three components. One is structural component, Second is the process components and the output component. So in the structural component we have, there should be a properly calibrated instrument, there should be experience of the laboratory staff, there should be qualified supervision of the therapeutic drug monitoring should be done. In the process components, there should be a proper judgment of proper indication, timing of the sample collection should be proper, then there should be careful handling of analytical process steps. Coming to the output component, it should detect the ADRs in relation to the dose, there should be improvement of the cure rate and reduction of the cost burden of the therapeutic to the patients. And what are the different analytical methods which are used in therapeutic drug monitoring? They are spectrometry, thin layer chromatography, radioimmunoassay and ELISA. What are the different types of sample that can be taken for therapeutic drug monitoring? Usually we take the serum sample or the plasma sample, and apart from that nowadays saliva is also used. And serum sample is the most routine method when plasma protein binding is not altered, and if plasma protein binding is altered, like in cases of hypoalbuminemia or liver diseases, free serum concentration is usually measured. Now, the uses of saliva as a sample in therapeutic drug monitoring is increasing because the collection of the saliva is simple, it is non-invasive and does not require expertise, and it is best done before the next dose. Now what is the timing of the sample? So it is three cases arises in this. One, the drug has a long half-life. Second, the drug has a very short half-life, and in case of overdoses. So in case of long half-life, the usual sample collection time is after 4 to 5 T-half. Why this 4 to 5 T-half? Because after this 4 to 5 T-half, then only the steady state plasma concentration is reached. As you can see here in the concentration time curve, you can see that after 4 to 5 T-half, the steady state plasma concentration of the drug is reached. Next, coming to the cases where the drug has a short half-life. In this case, it is done immediately before the next oral dose. And during overdose, if the patient presents to the casualty, then the timing of the sample collection should be as soon as the patient presents to the casualty, and the repeat sampling should be done depending on the timing of the overdose. Now coming to the efficacy or the applications of the therapeutic drug monitoring. Now therapeutic drug monitoring is applicable as it increases the efficacy of the drugs having narrow therapeutic index like theophylline, methotrexate, valproic acid, or to determine that safe dosage regimen in case of long-term therapy, and also it has got an application in the proper dose adjustment, like we can calculate the revised dose rate basing on the previous dose rate into steady state plasma concentration or the target steady state plasma concentration divided by the measured steady state plasma concentration. And it has also got an assistance in cases of renal failure or liver failure cases where we need to determine the levels of the drug in the blood, and also it improves the cost benefit ratio and it decreases the cost burden to the patient. Coming to the limitations of the therapeutic drug monitoring. So this therapeutic drug monitoring, it has got a lot of applications, but still then it is being used in very selected cases in our country. Why this is so? Because it has got certain limitations. And what are these limitations? Because the equipments for the therapeutic drug monitoring, these are very expensive, and also in certain cases the population data for referring normal values is not always available. That is why the therapeutic drug monitoring is not rampantly done in all the centers, but a few selected centers in our country. So this is all about therapeutic drug monitoring. Thank you.